Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and my special guest today is Dr. Lauren.polivka. Dr. Lauren is a licensed physical therapist who graduated from Northwestern University with a doctorate of physical therapy. Welcome to the show, Dr. Lauren.
Thank you very much for having me.
Well, tell us a little bit about yourself first to get started. You have a doctorate in physical therapy. I'm not sure if everybody knows that that is something that you actually need a doctorate for. But how did you get started in physical therapy? What was the passion?
Well, I wanted to be a physical therapist ever since I was a young girl. I was a gymnast, and weirdly enough, even when I was in grade school, I was obsessed with injuries. I wanted to get hurt. I thought it meant if you got hurt and got to go to doctors and therapists, I thought that meant you were a more cool, aggressive athlete. So it started when I was young that I wanted to be taped from head to toe and wrapped up in braces and everything. And then through middle school and high school, I really knew and really developed the passion that was going to be physical therapy, and that I wanted to work with healthy, active individuals and work my way up in the sporting world. I went to University of Florida first to get my Bachelor's of Science in Exercise Science, and then became a strength and conditioning coach and a Pilates instructor, and then went back to school to finish everything off as a physical therapist. And through all of that experience and time, I happened to end up with my own pretty chronic medical condition, which really fueled my vision and passion for how I practice today. And so because of that, I was diagnosed with juvenile rheumatoid arthritis when I was 14. I am now also a certified holistic health coach. So I try to take all of this training and certification and really make a holistic functional medicine practice for active, healthy individuals and for elite athletes.
Well, it definitely sounds like you're very active as a child, and that you have done a lot of things with all the exercise physiology and Pilates, and it's definitely a lifestyle for you. But explain to our audience now, please, what is a physical therapist? What do you do, and what kind of clients do you serve?
As a physical therapist at large, meaning what the profession looks like no matter who you're working with. So if you're in the hospital, an inpatient rehab setting, orthopedics, stroke, or whatnot, we're really the movement experts in the field. Our goal is to take people that have movement problems, whether that's because of pain, surgery, a medical condition, being able to diagnose, evaluate, treat them, and really make sure that they are functionally hitting their goals as relates to outcomes and to recovery from whatever it is they're dealing with. And so, like I said, that's the one thing I think physical therapists need to be understood about and appreciated for, is that our goal is fitness and exercise. It just looks different for whatever clientele and population type you're working with.
Now, on your website, the two main words that pop out are repair and recover. Now, within your physical therapy practice, have you niched down to a certain area that you only work with a certain kind of people?
Yes. As far as the real people who, can walk in the door and fit the main bullet points of who I work with. Like I said, these are very high level functioning, either fitness enthusiasts, weightlifters, so meaning powerlifting, Olympic lifting, bodybuilding, and CrossFit athletes. Now, those are my three niches. If I'm going to go out at an event and work in a competition with my athletes, but I always say it really doesn't matter who you are or meaning how elite you might be, but it's that your goals are in line with why you come into my office. And what I mean by that is I'm not a pain management specialist. I don't work under the referral of physicians. So people who come to me are actually trying not to go to a physician. They want a holistic way of treatment. And they also want to avoid taking pills, want to avoid shots, injections, and they want basically a person who's an advocate for them to optimally figuring out how they can have their body heal themselves. And it's just that those individuals who do strength training in some capacity usually respond the best to my methodology.
So let's talk about some of the people that you work with. You've got the weightlifters, fitness enthusiasts, the CrossFit. What are some of the challenges that they have? We all think, these are the fit people, but there's obviously challenges they have from the rigor that they put their bodies through.
Yes, as it goes down to the elite level individuals, so those who are actual competitors, the stresses that they put on themselves and what they're trying to accomplish, meaning squatting a particular amount of weight, doing some crazy workout that should take them 3 minutes quicker than they actually are doing it at that time. Those guys, they just don't have a comprehensive recovery program. So what I mean by that is, in a lot of people's heads, they just think it's fitness at the end of the day, but these people are looking for all of the complementary stuff they need to be doing so that they can go hard every single day they go to the gym, which, like I said, in these worlds, it's not built into the everyday lifestyle versus you have a football player, right, in the NFL. He has an entire team of people to put him back together, to tell him what to do to warm up, to tell him what he needs to do afterwards, to make sure he recovers from game day. So it's just a very different style and a never-ending training, I guess, year, you can say, compared to other sports. So that's why I said I'm sort of the middle person there to figure out why they might start, to get pain, why they feel like they're always sore, why all of a sudden, one shoulder is doing something funky. As far as the just hard going, like I said, fitness enthusiast that still is a mom or a dad or a full-time, 9 to 5 or 9 to 8 person, is that person's, in their daily life, they're almost doing everything that's completely counterintuitive to what they're trying to create when they work out, meaning sitting at computers, for extended duration of time, commuting to and from work, maybe a high stressed environment. So they really, they're trying to push themselves so hard, but they don't have that gap they don't have anyone to bridge that gap of teaching them what to do to prevent injury. And then if pain or something starts to happen, they go to a doctor and the doctor goes, well, stop pressing 200 pounds over your head if your shoulder hurts. And they're just not going to do that because that's not their goal. Like I said, even if it's, the corporate executive that likes to lift weights. So they're looking for that person that understands them, understands their lifestyle, and wants to build, like I said, a comprehensive exercise program, treatment program. And then, like I said, I do a complete nutrition program for my clients as well.
Yeah, so obviously everybody has different needs, but how do you help these kinds of people that are just passionate and, like you say, they're going to do it anyway? Does it really just come down to education?
That's half of the battle, yes, because, no one has told them or really taught them what they're even doing and why they're doing it, because conceptually in most people's heads, it's just fitness, or their personal trainer might not have an extensive background at a university or with training that can help on those levels. So yes, education is huge. And I really just try to, as far as like homework and what I tell them to do, I try to make it as simple as possible that it fits into their everyday lifestyle, because the feedback I get as to why these individuals don't end up in a traditional physical therapy clinic where anyone can walk in the door is because they're doing the exact same exercise as the 80-year-old lady with knee pain is doing next to them. And so, they quit before they even came. And my treatments that I do are very, very specific to very healthy individuals that don't have any other medical problems and that really try to promote their bodies to heal themselves. So I can do one treatment on someone and they never come back because now they're educated. The treatment helped stimulate their body to heal. And then they've been given their home, exercises and homework to do. And so now, since they're so fit and want to do well and push their bodies to the limits, they respond so well that they don't need a ton of help like chronic pain management does.
Well, let's talk about some of the misconceptions. You mentioned chronic pain management a couple of times, and people might think that that's something that a physical therapy really deals with. And also, you've got the elite athletes and the 80-year-old woman and, doing the same kind of exercises. What misconceptions do you feel that some people have about the physical therapy industry?
At larger concerning what I do specifically, or a little bit of both?
A little bit of both, yeah.
I think one of the biggest things in today's world with physical therapy is that it has become very of this sort of like hands-on masseuse style of like work, meaning you go in and they stretch you out and they work on your muscles or stretch your joints, where I think those that are really, I feel, are innovative and are excelling in this world are really trying to go back to their roots that, like I said, we're the movement experts, and we need to constantly remind ourselves of that and make sure that our patients are also working with us and seeing to make that their goal. Pain is great, but so is being able to sleep through the night. So is be able to going up and down a flight of stairs carrying your laundry basket. So I think it's sort of fallen. I think there's a missing piece right now in that physical therapy world. And I think that's a little bit of why I think you're seeing sort of a big clinic where everyone looks the same and is doing the same thing. And I think we just have to remind ourselves a little bit more of that. Because then the next question people get is, do you do massage too? I'm like, I would no idea how to give you a total body massage. Right. I have no idea. And also, in the world of PT, I think you really need to, us as PTs need to be more keeping everyone responsible as to why they're working with us, versus, I need to get 20 insurance visits out of this person.
So what are some of the fears that some people have, maybe dealing with the elite athletes? What are some of the fears that they have why they wouldn't go to a physical therapist like yourself?
Well, like one thing I said is truly knowing and understanding an athlete and their body and what it really requires for these people to heal. An example of that is, I didn't even really understand it until I started doing CrossFit myself, even though I've worked out like crazy my whole life. But once I really started making like weightlifting goals and, endurance goals for myself, when you're as like an Olympic lifter, for example, I mean, they're fatiguing one thing we say about lifting is that they're fatiguing their central nervous system every single time that they work out. And what I mean by that is, their body's getting fried to exhaustion.
Mm-hmm.
And if you're going to try to, help someone heal and deal with someone whose bodies go through that type of stress, you almost have to recreate that type of stress. Otherwise, the brain and the immune system is like, whatever, just another day in the life of doing something. So that's why I said, even though what I do is currently is not as traditional, it works because I get what these athletes are doing to themselves, and being able to coach them through that and help them in a full-rounded manner, even meaning like talking to them about sports nutrition is the reason that they'll stay. And I mean, they're going to walk in my door before they'll go into a physician's office any day. And if they do have to go to a physician's office, they'll only go to who I recommend. Or if they have to go to a massage therapist, they only will go to who I recommend.
Well, it's definitely better for them to, go to somebody who really understands, what a high level athlete is going through. Now, somebody that is dealing with pain for a long time, what stops them from taking action earlier to fix these problems?
Well, when it comes to, like I said, sort of high performing individuals at large, like I said, the fitness enthusiasts, that's also the executive, even marathon runners are a perfect example. First of all, they don't want to be told that anything major is wrong. So they don't want to go to the doctor and get a bad report.
Mm-hmm.
Second is they are feared that they're just going to be told to stop. You have to stop. You have to take 8 weeks off. You have to do X, Y, and Z. Versus trying to figure out a comprehensive plan that sort of meets everyone's needs. And obviously, we never put an athlete at risk, but there's a way to still be an advocate for what their goals are. And those are the two main things, like I said, when I work with healthy, fit individuals, is they're too scared to stop.
Well, you're dealing with lifestyle and habits, and it's hard for them to make those changes.
Yeah, it's their stress reliever. It's the way that they, cope with relationships. It's the way, it's stuff that they do with their kids. So, and that's the one thing is I tell everyone, like, you're in charge of your own body, and I don't know what it feels like to live inside your body. So I'm going to listen to you and do, full evaluations on you and rule in and rule out all the crazy things. But usually, like I said, if this is fitness stuff based things, these are usually, like I said, it's just a lack of even awareness or understanding what's going on and how they can do some simple things to fix it. So I won't ever take anything away from someone unless I'm going, if I were you, I would go get an x-ray right at this very second. Mm-hmm. So
give me an example, Dr. Lauren, of how you've been able to help somebody, not naming any names or anything specific like that, but give me an example of a patient that has come to you, what problems they had, how you were able to solve their problems, and how you got them back to living the lifestyle that they want to live.
Yeah, I mean, since we didn't mention this yet, but I don't take insurance. So when someone comes to me, they usually have been through the ringer already of, if it's a real sort of lingering, I've had a bad knee since I was in high school type of case, right? Mm-hmm. So once they come to me, they are ready to do whatever it takes, try anything. They're exhausting their resources. One example is one of my clients. He's 59 now. I started working with him when he was 54. And visually, meaning what the structure of his knee looks like from all these old track injuries. And if you look at his x-rays, this man's knee was horrible. And he, the doctor's like, you have to get a total knee replacement. Like, he's going in for constant joint injections and things, doing whatever he can do not to have to get surgery.
Mm-hmm.
And I would say I like to bring back to life and put back together old injuries or bad, surgeries that didn't heal properly and things like that. It's a challenge for me. It's and so he's a bodybuilder. I mean, if this man isn't in the gym 5 days a week, I mean, you might as well call him dead, right? And we came up with a treatment plan. I talked to him about a lot of the other issues in his lower leg that were creating this knee problem to be even worse. Had horrible range of motion. I got him back full range of motion of his knee. I mean, the doctor still to this day is going, how on earth did that happen? I've never seen someone be able to get as much function back. He's still squatting, still deadlifting, still doing everything that he needs to. And, he's so happy and so fortunate. And, he follows all his home instruction. And when he needs to, he comes back in and we work on it. So that's an example of just, of knowing and understanding a body and a lifter and all the systems of the human body that can be working together to help someone feel better.
Yeah, definitely. When you get up in years, I guess, the body does tend to wear out a little bit, but you're taking away lifestyle, even at 54, if he's not getting to the gym every day to get that range of motion back and to be able to still go to the gym and do what he loves to do has got to be, very rewarding.
Mm-hmm. Yeah. And there's, there'll be some other things. I have a woman right now who had what's called a diastasis, which happens when your abdominal wall sort of breaks apart during pregnancy because of the size of the baby. And, if you look up all the stuff of what she should be doing, what she shouldn't be doing, I mean, it's overwhelming to her. Some doctors will go, you need surgery right away and whatnot. The first thing she had to learn how to do is that she didn't know how to breathe properly. So she was actually putting too much stress on this area because she wasn't breathing well. And I literally gave her, these homework assignments of, well, you need to go home and learn how to breathe and move your abs and your ribs together and all of these things. And I mean, it's amazing. We have done only 6 training sessions together, and her abdominal issues reduced by 50%. And I mean, that's nothing. In these cases,
that's excellent.
She thought she was going to be in the gym with me for 6 months.
So there's a lot of different things when you're dealing with the whole body, but what do you see mainly with the athletes that you deal with? Is it knees, joints, lower backs?
Really, I mean, really everything. Obviously, tons of low back, hips, and shoulders. And the interesting thing is that it all usually stems off of issues and imbalances in their pelvis. So I really mean if you Googled a picture, what does your pelvis actually look like? I'm talking about that big, huge mass of bone that sort of connects the upper body to the lower body. So we're not talking about the spine anymore. We're not talking about just the hip joint anymore, but really this huge bone that has the most incredible amount of muscles connected to it. And what's happening in today's world is that people, we sit for a living, we drive only using our right leg, we mouse with our, the mouse on the right side of our body. Whenever we sit in chairs, we cross one leg over the other leg. And it's all these little super non-symmetrical stuff that we're doing, and we're completely changing our posture, like I said, in this massive area of our body that all these big muscles, small muscles, abdominal muscles, everything connects to. And all day long, we're like creating this twist. And then we want to do something like run or do a squat or, do something in the gym. And of course, we're going to eventually get pain because we're crooked. And then we're trying to do things where the body should be able to move in unison. And it's usually the pelvic region it's only really paid attention to a lot. I would just say making complete blanket statement in women's health issues, but it's not usually fully understand or appreciated as it's related to sports. So, that's a huge educational piece for people. Just the takeaway of going, look at how huge this area is of your body. I mean, how much bone there is. It's literally like a huge bowl. And let me show you pictures of all, I have this sort of dummy sort of drawing in my office, and I just show them that. And then, say, cross your right leg over your left. Now cross your left leg over your right. And they're like, I can't. And that, that's already an eye-awakening moment for them again, like, okay, I guess this is why I'm having pain or why I can't do what I want anymore. Versus someone going, let's take an x-ray of your spine. Your spine isn't perfect. This is degenerative. This curve is off. They're like so overwhelmed and like, I don't even know what that means anymore.
Well, I'm sitting here in my chair trying to straighten up and correct my posture as you're talking here. We do have some very bad habits, and we do tend to sit and crouch over and look at phones and computers. So I can see that this problem is not getting any better.
And that's, when people go, this sport's bad for you, this fitness thing is bad for you, this thing isn't bad for you. I'm like, none of it's bad, because we're humans. And if you look at the scope of all the differences in sports, it's such a variable and a variety, right? And so it's just, we have to understand the sort of, like I said, initially with the fitness enthusiast that wants to do these high functional things, but it's the same thing with someone who just wants to run 3 miles casually. Is you have to appreciate and understand what you're doing the other 23 hours a day that you're not doing your 60-minute workout. And you have to appreciate and understand that, and the little things. And even, I'll make people set like reminders on their computer to do X, Y, and Z throughout the day. And it just, it changes everything so much, and it's not some complicated, overwhelming, physical therapy program.
It's oftentimes the little things that make that big difference. Now, Dr. Lauren, let's talk about insurance for a minute and the way that you run your business. You are an all-cash business, is that correct?
Correct.
Now, what made you come to that decision, and maybe explain a little bit about the insurance industry and how that works?
Well, I mean, it really started when I was working as a strength and conditioning coach and being able to watch how their business ran. I worked at sort of like a professional sports academy, like where the athletes come and basically sort of live and train there for a period of time. And so, we didn't take insurance there. We didn't care about insurance at all, meaning we just did what we wanted. If the guy had to come in 3 days a week, 5 days a week, 2 times a day. And so going into PT school, I already sort of had a vision of what I wanted to do. And then coming out of school, when I was getting back into that same industry, again, we didn't take insurance at the time, and we could do whatever we wanted, and we could treat people for, like 25% of what they would be trying to be doing in a regular clinic and getting better results, meaning they never come back. And so a couple things going on that is, first of all, it is more money up front, but we're, like I said, I'm not I told someone, I might see you once, I might see you 4 times. Like, I have no idea. But if you're not progressively better by the second time I see you, like, my plan is not working for you. It needs to happen that quickly. And so it's like I said, it's truly making a comprehensive program and trying to maximize someone's results as quick as you can. When you work with a pro athlete, you know, if you told them, yep, your back pain, it's probably gonna take 3 months, you know, for the fact that you have a muscle spasm in your back. I mean, you'd be fired off that team right away. You have to maximize everything that you can do to get that person back on the field as soonly and as safely as possible. And that approach and desire, you know, hasn't really been brought into the physical therapy world for the everyday individual. So like I said, it's a little bit more money up front, but it meets people's goals because I don't have any other staff but myself. I don't have to sit on phones with insurance companies, which then I would have to charge people even more money or charge the insurance company even more because now I have to pay 5 people. I don't have to worry about the fact that this insurance provider won't cover this. This insurance provider does cover this. Because then what happens in the insurance world that people don't even know in the back office, people are making decisions sometimes knowing based off of what type of things that insurance provider likes to cover versus not cover. And
so
that's just not,
it's
me,
basically
it's not ethical.
No, you've got to have your patient's best interest at heart, and it doesn't seem like that is a way to go when you're just, you know, doing whatever you're allowed to do by, you know, the insurance, which is the middleman. It doesn't really make sense. Now,
well, and I think it's also very outdated. You know, stuff that they'll cover one thing like a hot pack or a cold pack, but then they might dispute you on something that's actually like a functional outcome-based thing that has results, except the companies aren't up to date. And, you know, or you have to get authorization before you do X, Y, and Z and all this stuff. And it's, you know, I always say it's totally fine if, you know, you can sit there and tell a patient, this is what you're eligible for. It's not that you're eligible for physical therapy. You're eligible for only X amount of time with me versus X amount of thing. I mean, and that person, like I said,
that's not what they want to hear.
Yeah. And I ask people, I'm like, you know, do you know, I don't take insurance, and they're like, great, because I don't want to use my insurance. It's a hassle.
Right.
You know, it becomes that way too. And like I said, a lot of the people that come to me, you know, have been in and out and through doctors for all this stuff, and it has led them nowhere. So they don't even want to deal with the system anymore.
Well, it certainly seems like it gives you more freedom to do what needs to be done, and the patients are happier. Well, Dr. Lauren, thank you very much. You've given us a ton of information here, but I'm sure we're just scratching the surface of your knowledge. If there's any last thoughts that you would like to leave, or any steps or secrets to success, what would they be?
I think it's just being authentic and honest. And, you know, I treat every single person that comes in my room the exact way I would want and expect to be treated, or my family member. And there's no one perfect idea for a patient or a client. You know, that's another thing is, who cares if they have back pain, shoulder pain, or if they just want to learn how to run better? You know, what they say and what they want always comes first, and you fit, you know, a way to be a part of their team versus trying to force them to be, you know, to sell them on being a part of yours. And I think that, like I said, especially in today's world where healthcare is sort of all over the place and we don't know the future of a lot of things, someone that can, you know, you don't have to know everything, but if you can sort of help know a little of everything to help guide people in the right direction. That's how you gain the trust of those who want to keep coming back and, never stop learning.
Well, we've been listening to Dr. Lauren Polivka. She's a doctor of physical therapy. She's going to help you repair and recover. Dr. Lauren, what is the best way for people to get in touch with you?
The best way is on my website. So there's an inquiry page on my website. There's, if you're in the Atlanta area or the Southeast, you can schedule any appointments on my website. And then if you're a professional yourself, just looking for some guidance or experience or whatnot, you can inquire that as well. And that website is www.L as in Lauren, P as in Polivka, D as in David, P as in Peter, T as in Tom.com. So it's LPDPT.com.
Excellent. And do you have a phone number, social media, or anything else that you'd like to give out?
I sure do. My phone number is here in Atlanta. It's 404-805-6720. And you can gain access to a lot of different topics and exercises and tips for me on Instagram, which is LAPolivka11.
Excellent. Well, we'll make sure that we have them in the show notes. Dr. Lauren, thank you very much for being a guest today on Business Authority Radio.
Thank you very much.
And to our listening audience, if you like what you hear, hit that like button, share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.